Welcome back to Medic Talk, everyone. Today we're diving into something that's like a textbook example of how genetics and evolution can be all mixed up.
It's pretty wild.
Sickle cell anemia.
Yeah, it might seem pretty simple at first.
Right.
But trust me, the more you learn about it,
Oh, yeah,
the more interesting it gets.
for sure. And for anyone going into healthcare,
Absolutely.
understanding sickle cell is like,
Essential.
yeah, it's crucial.
Yeah.
It's just incredible to think that people used to rarely even make it past childhood with this. And now they're living into their 50s.
Into their 50s. Yeah.
It just shows you how far we've come.
Huge medical progress.
Right.
Yeah.
Absolutely. So before we get into treatments and all that, let's break down how it actually works.
Okay, so imagine like a busy city center
Okay.
where all these little delivery trucks are zipping around.
That's it.
Those are our red blood cells
What-
carrying oxygen through all the streets and avenues.
The blood vessel.
Exactly, the blood vessels. So what happens if those trucks, those red blood cells,
Yeah. What happens when they become sickled?
well, instead of being all nice and round,
Uh-huh.
they get stiff and kind of crescent-shaped.
Oh, wow.
Yeah, it's like trying to fit a big, long truck down a tiny, winding road.
Oh, so they get stuck?
They get stuck. They cause a traffic jam in those tiny blood vessels.
Oh, man. Okay.
Yeah.
So that's what leads to the anemia we see.
Exactly. The oxygen can't get to where it needs to go.
Oh, wow.
And all the tissues and organs are like, hey, where's our oxygen?
Right. They need it.
They need it. And it's not just anemia. It can cause
Right.
intense pain organ damage.
Wow.
Whole bunch of complications.
Speaking of complications,
Yeah.
our source material mentioned that sickle cell anemia disproportionately affects Black individuals.
Right.
Why is that?
That's a great question. In the U.S., about 1 in 365 Black newborns has sickle cell anemia.
Wow.
And globally, it's even higher in places like sub-Saharan Africa.
It's a lot.
Yeah, and a lot of that has to do with malaria.
Malaria.
Yeah.
Now, what does a parasitic disease have to do with a genetic blood disorder?
That's where things get really interesting.
Okay.
Having just one copy of the sickle cell gene, which we call sickle cell trait,
Okay.
can actually protect against severe malaria.
Whoa. So it's like a good thing and a bad thing at the same time?
Kind of. It's like a double-edged sword.
Wow.
The malaria parasite has a really hard time surviving in red blood cells that are affected by sickle cell trait.
Interesting.
So in areas with a lot of malaria, people with this trait were more likely to survive and pass on the gene.
Huh.
So over time...
It became more common in those populations.
Exactly.
That is so fascinating. Okay, so let's dive a bit deeper into the science behind this.
Right.
You mentioned a specific gene, so what's going on at a molecular level?
It all comes down to hemoglobin.
Okay.
You know, the protein inside red blood cells that carries oxygen.
Right.
So in sickle cell anemia, there's a mutation in the gene that makes part of hemoglobin. This part is called beta globin,
Okay.
and it leads to the production of this abnormal hemoglobin called HbS.
So HbS is the problem.
That's the one. But remember, you usually only have symptoms if you inherit 2 copies of this mutated gene.
One from each parent.
Right.
That's what we call sickle cell disease.
That's it.
Okay, and if you only have one copy, that's sickle cell trait.
Yep. And you're usually asymptomatic.
Okay, that makes sense.
Okay.
So how is sickle cell anemia detected?
Early detection is so important.
I bet.
And luckily, we have newborn screening programs for this.
That's great.
Yeah, a simple blood test, usually done a few days after birth, can tell us if a baby has it.
So that early detection can make a huge difference.
Oh, absolutely.
Right, because then you can start managing it early on.
Exactly. It allows for proactive management education for the family.
Right.
And we can try to prevent or minimize those complications.
Okay, so you mentioned complications earlier.
I did.
What are some of the most serious ones?
Aside from the chronic anemia, which can be really tough on its own, people with sickle cell are at risk for a lot of different complications.
Like what?
Well, one of the worst is a sickle cell crisis.
What happens during a sickle cell crisis?
So picture those weird-shaped sticky sickle cells start clumping together in those tiny blood vessels.
You know.
It's like a massive traffic jam, but on a microscopic level.
Wow.
This blocks off the oxygen supply to the tissues and organs.
Right.
And that can cause excruciating pain and even organ damage.
So what triggers these crises?
It can be a lot of things: dehydration, infection, stress,
Wow.
extreme temperatures, even high altitudes.
Really?
Yeah, it can be really unpredictable, which makes it super hard for people living with this.
It sounds so tough.
It is. And there are different types of sickle cell crises, too.
Oh, really? Could you explain some of those?
Yeah, so one of the most common is a vaso-occlusive crisis, or VOC.
And why are VOC so painful?
Well, those sticky cells block blood flow mainly in the bones.
Ouch.
Yeah, so you
Yeah.
get this intense pain, usually in the limbs, back, or chest. It's like a really deep throbbing ache that can last for hours or even days.
That sounds awful.
Yeah.
You also mentioned a splenic sequestration crisis.
Right. So in this type, a bunch of sickled cells get trapped in the spleen,
Uh-huh.
which makes it swell up really fast.
Oh, wow.
This can cause a sudden drop in blood pressure
Oh, no.
and really bad anemia, which can be life-threatening if it's not treated quickly.
So that's a medical emergency.
Absolutely.
Right.
And sadly, repeated splenic sequestration crises can actually damage the spleen,
And that's a problem because...
leaving the person more vulnerable to infections.
Right, because the spleen is so important for fighting infection.
It is. That's why preventing these crises is key.
Yeah.
But sometimes complications happen anyway.
I see.
Another one is acute chest syndrome.
Yeah, how to say.
So it's a life-threatening complication where the sickled cells block blood flow in the lungs.
In the lungs.
Yeah, and that causes chest pain, fever, trouble breathing, a cough.
Those sound like cold or flu symptoms.
They do, but in someone with sickle cell, it can be way more serious.
Oh, wow. Okay.
It's super important to recognize the signs early because it can get bad really fast.
And you need to get to a doctor right away.
Immediately.
It sounds like knowing the specific issues with each type of crisis is so important.
Absolutely. Each one has its own challenges and needs the right treatment fast.
So that brings us to managing sickle cell disease as a whole.
Right.
It sounds like a lifelong journey.
It is. It takes a whole team of experts.
Wow.
Hematologists, nurses, pain management specialists, and often others depending on the person's needs.
So real team effort.
For sure. And the goal is to prevent problems and use treatments to minimize complications and help people live better.
That makes sense.
Mm-hmm.
So what are some of the key things for preventing problems with sickle cell?
A lot of it is lifestyle changes and proactive healthcare.
Okay.
Staying hydrated is super important
Yeah.
because dehydration can trigger a crisis.
Oh, wow.
Regular vaccinations are key to avoid infections.
Right.
And sometimes we prescribe antibiotics just in case to prevent certain bacterial infections.
So it's all about minimizing those triggers.
You got it. And on the treatment side, we've made some amazing progress.
This is what I've been waiting for. Tell me what's new, what's giving hope to people dealing with this?
One of the biggest breakthroughs has been a medication called hydroxyurea.
Oh, yeah, I've heard of that one. What does it do?
It's a game changer because it helps the body make more fetal hemoglobin.
And that's good because...
Yeah, remember, fetal hemoglobin doesn't sickle.
Oh, right. So it's like boosting the body's own good hemoglobin.
Exactly. The kind that flows easily through those tiny vessels.
Wow. So what does that mean for patients?
It can really help. It reduces how often and how bad the pain crises are.
That's great.
It helps with the anemia.
Okay.
And it can even help people live longer.
That's incredible. It sounds like hydroxyurea has been huge for sickle cell treatment. Are there any other new treatments?
There are. Another exciting one is a monoclonal antibody called crizanlizumab.
Okay, what does that one do?
It works by stopping those sticky red blood cells from sticking to the blood vessel walls.
Oh, so it helps prevent blockages.
Exactly. Less blockages means lower risk of vaso-occlusive crises.
That's amazing. And of course, there's always blood transfusions for severe anemia.
Right. Blood transfusions have been a key treatment for a long time.
And I know there's been talk about bone marrow transplants as a possible cure.
Yeah, that's right.
How does that work?
So bone marrow transplants can actually cure sickle cell,
Wow.
but it's a really complicated procedure and it comes with some serious risks.
So it's not for everyone.
Definitely not. It's a big decision, and doctors have to carefully consider each patient's health to see if it's right for them.
This has been incredible. We've learned about the genetics, the evolution, treatments.
It's really fascinating, isn't it?
It is. Sickle cells is so much more than just a change in cell shape.
Absolutely. It's a reminder that as future healthcare providers, you need to look at the whole picture.
The whole person, not just the disease.
Exactly.
And understand the social factors that play a role.
Right, and make sure everyone has access to the care they need.
That's so important. Now, I'm curious about gene therapy.
Ah, yes, gene therapy.
What makes it so promising for sickle cell?
Well, gene therapy aims to actually fix the genetic problem.
So instead of just managing the symptoms, you're talking about going right to the source and fixing it.
That's the idea. It's like rewriting the genetic code.
That's mind-blowing.
It is pretty amazing. And the early results from clinical trials have been really encouraging.
Really?
Yeah, some patients are having way fewer pain crises and their quality of life is much better.
That's amazing. Can you tell me more about the different ways they're using gene therapy for sickle cell?
Sure. So one way is to use a harmless virus.
A virus.
Yeah. It acts like a delivery system to bring a healthy gene into the patient's stem cells.
Okay.
Then those modified stem cells can make healthy red blood cells.
So it's like replacing the sickled cells.
Exactly, like reprogramming the body's factories to make the right stuff.
That's fascinating. Are there other approaches too?
Yeah, another one focuses on getting the body to make more fetal hemoglobin again.
Oh, right, because that one doesn't sickle.
Exactly.
Yeah.
It's like using the body's own natural defenses against the disease.
It sounds like there are a lot of promising options being explored.
There are. But gene therapy is still pretty new.
Right.
And there are challenges.
Like what?
Well, one of the biggest ones is making sure it's safe and that it works long term.
Right. You don't want any surprises down the road.
Exactly. We have to be really careful when we're messing with something as fundamental as our genes.
I can imagine. And what about cost?
Yeah, that's
Yeah.
another big challenge. Gene therapy is complicated and expensive,
Yeah,
so it might not be available to everyone who needs it.
especially in communities that are already struggling.
Exactly. That's something we need to talk about as a society.
Yeah, we need to make sure these treatments are available to everyone.
Absolutely. It's about equity and fairness.
Well said. So we've talked a lot about the physical side of sickle cell,
Yeah.
but it also has a big impact on people's lives beyond just their physical symptoms, right?
Oh, absolutely. Living with a chronic condition like sickle cell is tough, emotionally and socially.
That makes sense. It must be hard to deal with the constant fear of a crisis.
It is. Imagine living with that hanging over your head all the time.
The pain, the hospital visits, the disruptions to your life.
Exactly. It makes it hard to plan for the future.
And it affects everything.
Everything. Schoolwork, relationships.
Wow. Plus there's the stigma.
Yeah, people don't always understand genetic diseases,
Right.
and that can lead to misconceptions and even discrimination.
That's so sad. It seems like we need to do a better job of raising awareness about sickle cell.
We do. We need to educate people, break down stereotypes, and create a more supportive environment.
So it's not just about treating the body.
Right.
It's about supporting the whole person.
Absolutely. Their physical, emotional, and social well-being.
It sounds like a holistic approach is so important.
It is. It's about helping people with sickle cell live full and meaningful lives.
You know, this deep dive has really shown me that sickle cell is about so much more than just a change in cell shape.
I agree.
It's about genetics evolution, the whole human experience.
It really is. And it reminds us that as future healthcare providers,
Yeah.
you need to treat the whole person.
Not just the disease.
Exactly.
So we need to think about the social determinants of health
Right.
and advocate for everyone to have equal access to care.
Absolutely well said.
Now, as we wrap up this part of our deep dive,
Yeah.
I want to leave our listeners with something to think about.
Okay.
Knowing everything we've learned about sickle cell and how much it affects people's lives,
Uh-huh.
what role do you see yourselves playing in improving health care for those living with this condition? It's not just about memorizing facts for a test.
Right.
It's about using what you know
And your compassion.
to make a real difference in people's lives.
Exactly. And remember, this is just the beginning.
Right.
There's always more to learn,
So much more.
more to explore, and more ways to advocate for better care for people with sickle cell.
This has been an amazing learning experience. Thank you
Mm.
so much for sharing your expertise with us.
It's my pleasure.
And to all our future healthcare heroes out there.
Keep learning.
We hope this deep dive has given you a better understanding of sickle cell
And inspired you to keep learning.
and to advocate for your future patients.
Absolutely.
Okay, so let's move on and talk about gene therapy.
All right.
Tell me what makes gene therapy so promising for sickle cell.
Well, gene therapy aims to correct the underlying genetic defect that causes sickle cell anemia. It's like going right to the source of the problem and fixing it at its root.
So instead of just managing symptoms or trying to prevent crises, we're talking about potentially rewriting the genetic code. That's mind-blowing.
It really is, and the results from early clinical trials have been incredibly encouraging. Some patients have seen a dramatic reduction in pain crises and an overall improvement in their quality of life.
That's fantastic news. Could you elaborate on the different approaches being explored in gene therapy for sickle cell anemia?
One approach involves using a harmless virus as a delivery system to introduce a functional gene into the patient's stem cells. These modified stem cells then produce healthy red blood cells, essentially replacing the sickled cells.
So it's like reprogramming the body's own cellular factories to produce the right kind of hemoglobin. That's fascinating. What other approaches are being investigated?
Another approach focuses on reactivating the production of fetal hemoglobin, which, as we've discussed, doesn't sickle. It's like tapping into the body's own natural defense mechanism against the disease.
Well, it seems like there are multiple promising avenues being explored. But I imagine gene therapy is still a relatively new field, and there must be challenges to overcome.
You're right. One of the biggest challenges is ensuring the safety and long-term effectiveness of these therapies. We want to make sure that the genetic modifications don't have any unintended consequences down the line.
That's a crucial point. Altering something as fundamental as our genes requires careful consideration and rigorous testing.
Absolutely. And another challenge is accessibility and affordability. Gene therapy is a complex and expensive process, making it potentially out of reach for many patients, especially those in underserved communities.
That's a concern with any groundbreaking medical advancement.
Yeah.
We need to make sure that these life-changing treatments are available to everyone who needs them, not just a privileged few.
Exactly. It's a conversation we need to have as a society to ensure equitable access to these potentially life-saving therapies. Now, while we focused a lot on the physical aspects of sickle cell anemia, it's important to remember that this condition also has a profound impact on individuals' lives beyond the physical symptoms.
Yes, you're right. Living with a chronic condition like sickle cell anemia comes with its own set of emotional and social challenges.
Absolutely. Imagine living with the constant threat of excruciating pain crises, the fear of organ damage, and the limitations it places on your daily life.
It must be incredibly difficult to cope with the uncertainty and the potential disruptions to education work and social life.
It is, and there's often a stigma associated with genetic diseases which can lead to misunderstanding and discrimination.
That's heartbreaking. So it's crucial to address not just the physical symptoms, but also the emotional and social well-being of individuals with sickle cell anemia.
Absolutely. Providing comprehensive care means offering support groups, counseling services, and resources to help individuals navigate the challenges of living with this condition.
It sounds like a holistic approach encompassing medical, psychological, and social support is essential for ensuring the best possible outcome.
Exactly. It's about empowering individuals to live full and meaningful lives despite the challenges of sickle cell anemia.
You know, this deep dive has really driven home the point that sickle cell anemia is so much more than just a change in cell shape. It's a complex interplay of genetics evolution and the human experience.
I couldn't agree more. And it's a reminder that as future healthcare providers, you'll need to consider not just the disease itself, but the individual living with that disease.
We need to treat the whole person, not just the condition. And that includes understanding the social determinants of health and advocating for equitable access to care.
Well said. Now, as we wrap up this deep dive, I want to leave our listeners with a thought to ponder. Knowing what you now know about sickle cell anemia and its profound impact on an individual's lives, what role do you see yourselves playing in shaping the future of healthcare for those living with this condition?
That's a powerful question. It's not just about memorizing facts for an exam. It's about using our knowledge and compassion to make a real difference in the lives of our patients.
Exactly. And remember, the pursuit of knowledge doesn't end with this deep dive. There's always more to learn, more to explore, and more ways to advocate for better care for those living with sickle cell anemia.
This has been an incredible learning experience. Thank you so much for sharing your expertise and insights with us.
It was my pleasure.
And to all our aspiring healthcare heroes out there, we hope this deep dive has equipped you with a deeper understanding of sickle cell anemia and inspired you to continue learning and advocating for your future patients. It's about combining scientific knowledge with empathy and compassion to deliver truly patient-centered care.
Well said. And remember, you're embarking on this journey at a truly exciting time in medicine. With advancements like gene therapy on the horizon, the potential to transform the lives of those with sickle cell anemia is greater than ever before.
It fills me with hope knowing that we might be on the cusp of such groundbreaking treatments. But it also makes me think about the ethical considerations that come with such powerful tools.
That's a crucial point. As we delve deeper into the realm of genetic manipulation, we need to engage in thoughtful discussions about the ethical implications. Who has access to these therapies? How do we ensure equitable distribution? These are questions we need to grapple with as a society.
It's a reminder that scientific progress must go hand in hand with ethical responsibility. We can't just focus on the what without considering the why and the how.
Exactly. We need to be mindful of the potential unintended consequences and ensure that these advancements benefit all of humanity, not just a select few.
This deep dive has been incredibly eye-opening. We've covered so much ground from the molecular mechanisms to the latest treatments and even delved into the social and ethical dimensions of sickle cell anemia.
It's a condition that truly exemplifies the interconnectedness of science society and the human experience. And it highlights the importance of ongoing research education and advocacy.
Speaking of education, I have to say that this deep dive has been an incredible learning experience for me, and I'm sure for our listeners as well. It's amazing how much depth and complexity there is to a condition that on the surface might seem relatively straightforward.
It's a testament to the fact that there's always more to learn, more to understand, and more ways to improve the lives of our patients.
Before we wrap up, I wanted to circle back to something you mentioned earlier, the psychological and social impact of living with sickle cell anemia. Could you expand on that a bit more? What are some of the unique challenges that individuals with this condition face?
Well, imagine living with the constant threat of a pain crisis that could strike at any moment, sending you to the hospital and disrupting your life. That level of uncertainty can take a toll on mental health and make it difficult to plan for the future.
It must be incredibly challenging to navigate education work and relationships with that hanging over your head.
It is. And then there's the stigma that often surrounds genetic diseases. Some people might not understand the condition, leading to misconceptions and even discrimination.
That's heartbreaking. It sounds like raising awareness and promoting understanding of sickle cell anemia is crucial.
It is. We need to educate the public, break down stereotypes, and create a more supportive and inclusive environment for individuals living with this condition.
So it's not just about treating the physical symptoms, it's about addressing the whole person, their physical, emotional, and social well-being.
Exactly. It's about providing comprehensive, compassionate care that empowers individuals to live full and meaningful lives.
This deep dive has really opened my eyes to the multifaceted nature of sickle cell anemia. It's a condition that demands our attention, our understanding, and our commitment to finding better treatments and improving the lives of those affected.
I couldn't agree more. And as future healthcare professionals, you have the opportunity to make a real difference in the lives of these individuals. Never underestimate the power of your knowledge, your compassion, and your advocacy.
Well, on that inspiring note, I think it's time to wrap up this episode of Medic Talk. Thank you so much for joining us on this incredible journey into the world of sickle cell anemia. We hope you've learned something new, gained a deeper understanding of this complex condition, and feel inspired to continue learning and advocating for your future patients.
It's been a pleasure sharing my insights with you and your listeners. Remember, knowledge is power, and with great knowledge comes great responsibility. Use your knowledge wisely, compassionately, and always in the service of others.
That's a perfect message to end on. To all our listeners, keep those brains buzzing and those hearts compassionate. Until next time, this is Medic Talk signing off. It's really about using that knowledge to provide truly patient-centered care.
Yeah, exactly. And it's a really exciting time to be going into medicine.
I know, right?
Like all these advancements, like gene therapy,
It's crazy.
the potential for helping people with sickle cell is huge.
I'm so hopeful about that. But it also makes me think about the ethical side of things.
That's a great point.
Right.
As we get deeper into this whole gene editing thing,
Yeah.
we really have to think about the ethics.
Absolutely.
Who gets these treatments? How do we make sure everyone has access?
It's a big deal.
It is. It's a conversation we need to have as a society.
Yeah, science can't just move forward without thinking about these things.
Exactly. We have to be responsible with these advancements.
I'm glad you brought that up. This deep dive has really been eye-opening for me.
Me too.
We've covered so much.
We have.
From the tiny details of how it works.
The molecular stuff.
Yeah, to the latest treatments.
And even the social and ethical aspects.
It's amazing how complex sickle cell really is.
At first glance, it might seem pretty straightforward.
Right. It's just a change in cell shape.
But it's so much more than that.
It really is. It shows that there's always more to learn.
Always.
More to understand.
Yeah.
And more we can do to help our patients.
Absolutely.
Before we wrap up,
Yeah.
I wanted to go back to something you mentioned earlier
Okay.
about the psychological and social impacts of living with sickle cell.
Right.
Could you talk a bit more about the specific challenges people face?
Well, just imagine always having this threat of a pain crisis hanging over you.
Right.
It could happen anytime.
Anytime.
Send you to the hospital, turn your life upside down.
That would be so hard to deal with.
It is. It affects your mental health, makes it hard to plan for the future.
Bet. And what about schoolwork relationships?
It affects everything. It's hard to live a normal life when you're constantly worried about a crisis.
And then there's the stigma we talked about.
Right.
People not understanding judging.
It's really sad. Some people just don't get it.
So we really need to educate people about sickle cell.
We do. We need to break down those stereotypes and create a more supportive environment for people living with this condition.
It's about more than just treating the physical symptoms.
Exactly. It's about treating the whole person.
Their mind, their emotions, their social life.
It's about giving them the tools to live a good life.
This deep dive has really shown me how multifaceted sickle cell is.
It really is.
It needs our attention, our understanding,
Absolutely.
and our commitment to finding better treatments.
And better ways to support people with the condition.
You know, as future healthcare professionals, you have the power to make a real difference in these people's lives.
That's right.
Never forget that.
Don't underestimate the power of your knowledge, your compassion, and your willingness to speak up for what's right.
Well said. Well, I think that's about all the time we have for today.
It flew by.
I know, right? Thanks for joining us on this journey into the world of sickle cell anemia.
It's been my pleasure.
We hope you've learned something new and that you'll keep learning.
There's always more to learn.
And keep advocating for your future patients.
That's what it's all about.
And remember, knowledge is power.
Use it wisely.
Use it compassionately.
And always for the good of others.
That's a perfect way to end this episode of Medic Talk. Thanks for listening, everyone.